Okay, thiazide diuretics. Thiazide diuretics are hydrochlorothiazide, chlorothalidone, and metolazone. Metolazone is the one which we often forget, so metolazone is something you have to remember. And the mechanism is they all inhibit sodium chloride channel in distal convoluted tubule. This is distal convoluted tubule. We are inhibiting the channel. So all the sodium and chloride will pass along with the water. We are not reabsorbing. Um, and if but calcium excretion is decreased because calcium is absorbed and we are absorbing calcium. So calcium excretion is decreased. We give thiazide diuretics and hypertension to decrease volume of the blood. We give an heart failure to decrease volume. We give an idiopathic hypercalciuria. Idiopathic hypercalciuria to decrease calcium excretion, which is important. Decrease calcium excretion and a nephrogenic diabetes insipidus. Nephrogenic diabetes is the one where ADH is not having receptors in nephron, so water is not being reabsorbed. Okay, this is one which where we find questions, but we are not sure how it works here. Thiazide, osteoporosis because it decreases calcium excretion. So whenever there's idiopathic calcium in the urine, we can decrease it by giving thiazides. And when there's osteoporosis, we can decrease calcium excretion from the body by giving thiazide to retain calcium. Idiopathic, okay, decrease calcium excretion. Thiazide decrease calcium excretion, so we give an idiopathic hypercalciuria and osteoporosis. And normally it's giving in hypertension and heart failure, and nephrogenic diabetes insipidus is a different use of thiazide, which I'm not sure about how it works there, but it works there by decreasing calcium and chloride reabsorption. So most of the sodium and chloride is not reabsorbed, so it's more hypertonic urine. A hypokalemia. Okay, we are decreasing potassium, we are decreasing, so hypokalemia is alkalosis, metabolic hyponatremia. Okay, we are decreasing calcium and sodium because we are not reabsorbing sodium. And hyperglycemia, hyperlipidemia, hyperuricemia, and hypercalcemia. Hypergluc, hypoglycemia, lipidemia, uricemia, and calcemia. Thiazide is going to increase gluc in the body by G glucose, L lipids, U uric acid, C calcium in the blood, glucic, and potassium is down. Potassium is going to be down and sodium is going to be down in thiazide. It's going to cause metabolic alkalosis. Metabolic alkalosis.